Tonight in Medical Rounds, it's the world's most common adult movement disorder, essential tremor, affecting nearly 10 million people in the U.S., which is more than 2% of the population. And joining us live to talk more about that is Dr. Duarte Machado. He is the co-director of the David and Rhoda Chase Family Movement Disorders Center. Good evening, Dr. Machado. Nice to see you again.
Good evening, Denise.
My first question is, Dr. Machado, for something so common, many people may not know what it means to have essential tremor. So could you explain what that condition is?
So essential tremor is a movement disorder whereby there's a postural and action tremor of the limbs, so hands, arms, and also head and neck. And it involves neurodegeneration of a part of the brain called the cerebellum, which is involved with coordination of movement.
So how do you treat or manage tremor disorders?
So it can be managed with oral medications, one of two types, either propranolol, a beta blocker, or primidone, an anti-epileptic drug. However, there are some patients who still don't have sufficient tremor control with oral medications, in which case we can employ a surgical option called deep brain stimulation, or DBS. DBS is the most effective way to treat tremor. In fact, I saw a patient just this past Friday and turned her DBS device on for the first time, and the result was really dramatic. In fact, she said it was a miracle.
Oh, good for you. That's great to hear. So hopeful for someone out there who may have this condition. And I understand that Hartford Hospital was chosen as one of only 3 sites in the country to host the International Essential Tremor Foundation Education Forum. So what can someone expect to learn should they attend?
Yeah, we're very proud that Hartford was selected as one of only 3 host cities, along with San Diego and St. Louis. At this event, participants will hear from the executive director of the International Essential Tremor Foundation. I'll be discussing diagnosis and treatment options, and an occupational therapist will discuss coping mechanisms for everyday living with essential tremor. So the forum should be exceptional.
It sounds so. And one last quick question. We have just a few seconds left, but I understand there's a support group for people with essential tremors. What can they gain from meetings?
Yeah, in Connecticut, we have one of the strongest essential tremor support groups in the country, and it's really been a model for other support groups. The group is headed by Helen Mosier, and it meets every other month. And participants can hear about the latest research studies, clinical trials, and even participate on forums and committees to participate in novel therapeutics or medical devices for essential tremor.
That's great. Knowledge is power, as they say. I'm a big supporter of that. We thank you so much, Dr. Duarte Machado, for providing such interesting information. Once again, the forum will be held at Hartford Hospital's Hubline Hall on June 1st from 1 to 4. And we will be right back with more news after the break.